This is Miguel Gomez at AIDS 2012 for AIDS.gov. I'm fortunate to be here with Mr. Phill Wilson, who did the opening session plenary on AIDS in America. And sir, I have two questions for you. First, will you share what the 2 or 3 takeaway points were from your plenary?
Well, the first takeaway from the plenary is that the U.S. has a big and still complicated epidemic. And that's the most important thing. The second thing, though, is that we have the tools to end the AIDS epidemic if we act, and if we act now. The question of whether or not we can end the AIDS epidemic has been asked and answered. The question now is, will we?
Well, thank you, sir. Really appreciate that and really encourage people to watch the live stream of your presentation. I have a second question for you. To the community you reach and serve, what is your message to them about an AIDS-free generation?
Well, I think that the point of an AIDS-free generation is that in a community, there's a role for us to play. We've had some remarkable scientific breakthroughs over the last few years. Pre-exposure prophylaxis. We know treatment as prevention. We've had advancements in microbicides. Those scientific breakthroughs are huge. But the community has to still be involved and engaged. We cannot end the AIDS epidemic without us. We will not get to an AIDS-free generation without us. But we have to be retooled. Unfortunately, too many of our organizations don't have the skills and the capacity in a post-healthcare reform world and in a world of HIV where biomedical interventions are critical.
What are some of the things we can do for our community to create that change, to give them the skill sets to move forward?
Well, the first thing that has to happen is that we have to have full implementation of the Affordable Care Act. The Affordable Care Act actually solves a lot of the challenges that we face if we're going to get to an AIDS-free generation. It eliminates pre-existing conditions. That's very important. It eliminates lifetime and annual caps. That's important. The health exchanges help people who are poor get access to health care. The 30 million people who are going to be brought into care, a large number of them are people who are living with HIV. The second thing, quite frankly, I feel very strongly that people who are living with HIV, we have to come out. We cannot develop the systems that we need to develop if we don't come out. We cannot have, our families are not going to love us and support us if they don't know us. And the only way for them to know us is for us to come out.
Well, thank you. And my last question for you, sir, is you have been working on this, the response to the epidemic, most of your professional life. We're here at the 19th International HIV/AIDS Conference. What is your sense of where we are, and what does it mean to you?
Well, we are at a deciding moment in the trajectory of the AIDS epidemic. This is our moment. This is our opportunity to begin the process of an AIDS-free generation. And I am very, very hopeful. I'm optimistic. And I'm looking forward to what we do with the things that are said at this meeting to make sure that we put them in practice next week when we go home.
Terrific. I want to thank Phill, and I want to thank you for listening. This is Miguel Gomez with AIDS.gov.